So let me start by really thanking my colleagues and all those on the front line who've been doing an excellent job. I've been there. I know it's no easy task. Specifically, my colleagues at the Ministry of Health, the technical team, who certainly have been doing their best, as we would expect. Having said that, as a medical practitioner of over 30 years, I can tell you one of the best experiments in creating panic and creating mayhem was Tuesday night based on the Prime Minister's manner in announcing what he announced. I have said before in this medium that we need to be mindful of the mental health of our people. The manner in which that was done only added to the anguish that persons are exposed to. That's fine if it's in a physiology lab with animals. Persons from Spanish Town are not animals, and we need to be mindful of that. I don't know that the necessary mental health support, which I've been speaking to, has been taken into consideration. But even more now, to add to that, can you imagine children of 3, 4, 6, 8, as opposed to preparing themselves to sleep, are now, as at Tuesday night, seeing their parents scrambling around to see if there's enough food until Saturday, for example, or whenever it is, to try to find a relative, as happened, to go somewhere else in Kingston and St. Andrew. The point I'm making is there are ways of doing this. One. Two, I recognize that it's not easy. There are persons trained in their sleep in doing this activity. I served with those persons. It's called the Jamaica Defense Force. There is no doubt that the government is struggling in holding the moving parts together. There are persons trained to hold moving parts together. They do it very well. Let's engage their services. I'm in touch with colonels in the army, people I served with in my time. They did not know about the shutdown. And so it's really not surprising that persons were able to successfully, having been told at 7 o'clock that there's a shutdown and you have a 2 hour period before the curfew comes in, that they were able to find themselves moving from St. Catherine to other areas of the country. And so that brings me to the point of really going round and round the mulberry bush. So what's happening is that the government finds itself chasing the virus. We need to move from chasing the virus to preventing infection. There is one way of doing that, and I'll hasten to say, as a public health professional, it is clear to me that at this point, we need to ensure, in an appropriate way, that we shut the country down. What's going to happen is we've started with St. Catherine, next is likely to be Kingston and St. Andrew, then another parish and another, moving around the mulberry bush, as obtained in Italy. The experience has been there. I'm not the brightest person in the world. I read, and so I know what I'm saying to you. Let's not repeat those mistakes. Now is the time to make plans, adequate plans, not in the manner in the experiment of Tuesday night with St. Catherine, adequate plans to shut the country down. In the same breath, we are interested. So we are told that of 787 persons employed to that call center, 258 were tested. We are told that of 65 samples done, 52 were positive. So where's the follow-up? What has happened to the results of 193 persons? And so we're really urging those who are managing this aspect of things to ensure that people are kept abreast of the situation. Another very important point would be the subject of medication treatment. As we're all aware, there is no specific product for treating anyone infected with the coronavirus. And I'll ask you, what possesses a government to say where there are possible products like chloroquine, like interferon, and a very new one recently from the Cubans as well, called CIGB 2020, and they are now doing clinical trials on those. What possesses a government to shut the door on potential products that could help persons who are dying? I would happily want to take chloroquine if that's available. I would happily want to take interferon if I become positive and then become in need of that. There's a University of the West Indies where I work, and just before this program, I spoke with Carl Bruce, who heads up the clinical services at the hospital. We would all be happy with the political will to conduct clinical trials to add to the literature, on the one hand, of the world in how interferon works or doesn't. And you do that by means of clinical trial. Do we have the patients? A resounding yes, we do, and we'll have more. And so that's one method of assisting the world using Jamaica's expertise in the scientific field to find out what works, how best. And in addition, there are countries not so willing to help us. In fact, they're more willing to prevent us getting necessary equipment we've ordered and maybe even paid for. Whilst on the other hand, there are countries like Cuba willing to assist, having sent 140 persons already. They now have not one, but 2 products. And we are not availing ourselves of that, which they would happily provide. The Minister of Health has indicated that that's been the advice he's been given. Well, my recommendation to the Minister of Health is that he might want to widen his circle of persons who advise him. I am offering myself, I am available. There are a number of colleagues of mine with the requisite knowledge available to provide the advice. What more does he need to see? But the challenges with testing persons who are having symptoms only, 1. 2, what more does he need to see with the challenges with getting everyone in the country to wear masks? Let him not allow himself to be misguided, to continue to be misguided. I think he means well. Let's widen that circle so the appropriate decisions can be made. And my final closing statement for today, now more than ever, not just in St. Catherine, but throughout the country, is when you want to do everything to prevent yourself being infected, namely washing hands where you can, wearing a mask made of anything, even an additional t-shirt, that's fine, a handkerchief, it doesn't matter. Keeping social distance and not going into crowds to allow yourself to be exposed to the virus, now more than ever. Thank you very much. I don't only believe, it's absolutely clear to me. We're at a juncture of health over money. As a physician, I'm choosing health. And I repeat, let's lock the country down and keep people alive. I want to live. I want you to live and everybody else. Let's lock the country down and keep people alive. My comments were made based on my expertise, which is medicine, public health specifically, in addition to being a psychiatrist. So I commented on mental health preparation. I commented on the fact that the horse has gone through the gate. We find ourselves chasing around the mulberry bush, the virus, and need to make decisions to ensure that we prevent infection. There are other people with other kinds of expertise. And it is why we need to open up the government, that is, to open up themselves, to avail themselves of persons with the requisite knowledge in an organized, structured way, to include addressing poverty, addressing hunger, and so on, addressing the closure of business, economic fallout. These are all areas with persons with expertise. I don't know everything, but I'm aware of persons who know other things I don't. Let's get people together at the table. I'm offering myself to the Minister of Health to help to widen his source of advice because it seems to be a little impaired. That's the most I can do as it relates to this. Let's get others to come in.